Hi everyone and welcome to ABCs of Anaesthesia. My name is Lahiru.
And my name is Kas.
And as we've been doing, these episodes are all about the anaesthesia training program and the application process for anaesthesia. And today we're going to go through references. Now I find this is a really challenging thing, especially in anaesthesia. Would you agree?
Yeah, it's probably one of the hardest things, and it's probably one of the points where you never really know if what you're doing is right. And,
that's right.
It's a bit of a gamble, I think.
Yeah. And I mean, I think in anaesthesia, it's tricky for a number of reasons. So, you've got, in our department, we've got maybe around 60 different consultants. So the chance of you working with one consultant more than once is pretty low. And so how do they really get to know you? How do they really get a feel for if you're good or not? But then every different profession has its own challenges. For example, if you're working on a surgical ward, maybe it's really your registrars that you're meeting with, but you're not really seeing the consultants. So either way, it's going to be challenging. So look, there's definite challenges, but these are some of the things that I'd go through. So what I thought we'd do, I'd share some of my tips and put it over to you as well, Kaz. Yeah. So often I encourage people, if they work well with a consultant and you feel like you're getting along well with them, I guess they've seen you at your best, maybe request to work with them again. I think that's not always possible, but definitely something that I would try just to have a go.
Yeah, so it's actually something I did, not a lot, but a couple of times, and really just chat to whoever it is you're rostering, have a chat to your critical care supervisor. And it is very possible to make it work because you are auxiliary and you're there to learn, so you can be moved when if you want to. So I did that twice because I wanted to work with a certain consultant and get a reference.
Yeah, you're welcome.
Yeah. No, I just turned up on my days off to do this with you. So I think definitely that's something you should do, and if it's within the ability of the department and the roster, I think they would definitely attempt it.
Yeah, that's right. Now, a few of the other things are the fact that when we are giving a reference to a critical care person or a junior person, we know that you're not going to be that competent with tasks. So when you think about it, unless you've already got a lot of experience, which most people wouldn't, how do you really stand above the other people, and how do you get a good reference? And so this is probably a lot to do with how to present yourself in many different ways. But I guess we'll come to this in the interview process. What would you want your trainees to be like if you're a boss is probably a good question. And I think we mentioned a few of those points, the reliability and thoroughness and I guess enthusiasm and work rate. I think these are some critical factors that every single person needs to have, especially if they want to get a good reference from someone.
Yeah, so one of the patterns I saw when I was getting references was really this idea of trainability as well. Yep. I think you use this specific word with me. Apparently I'm trainable. Thank you.
Yeah.
So I think the idea is, as Lahiru was saying, all these skills, like that, you're going to learn them. That's the point of the training program. If a resident came in a bit, able to intubate a grade 4 by themselves and put in lines and manage a thoracic case by themselves, then you would need a training program. So that's not the point. The point is, are you going to be a person who's going to be reliable, who's going to be trustworthy, who's going to be amenable to receiving feedback and learning? And that's a really difficult assessment, and that's where I think the referees come in. So it's much more about who you are as a person and the kind of impression you give, and I think focusing on that side of things is much more important than trying to really get every tube when you're a resident, when you're a quick care resident.
That's absolutely right. So I had one trainee who's really good, like so thorough with everything, really hardworking, and they just happened to miss the cannula every single time on my rotation, on my session.
We've all had those weeks.
Yeah, right. And to be honest, I cared zero that they missed the cannulas, and I honestly didn't care. I was so impressed that they'd done everything else. So all the other things that this particular trainee did was, they saw every single patient. You can't see the patients in person, but you can definitely look at the notes or look at the electronic medical record and just do a provisional chart. And, the amount of extra work it takes isn't too much, but they made that effort. They probably got in there early, like even half an hour early to do that. And with that, they had a rough plan. So they saw each of the patients, at least on paper, made a plan. They also would have checked the machine, drawn up any medications that they thought were relevant. And the extra thing that you may not know when you're starting out is to get everything else ready. So you might want to have an ultrasound scanner for nerve blocks. Maybe you expected that this was a difficult airway, or maybe you wanted to have a bit more of a teaching airway experience. So you asked for the video laryngoscope. And so these are all the little things that you can do to make every day go well. Come in early, check the machine, draw up the drugs, see every patient at least on paper, make a plan, and then do something extra if you want to learn.
So one of the things, continuing on from that I realized, I think, pretty late into my quick care job, is the more ownership you take of your list and the patients, the more ownership you will get over the anesthetic, and the more decisions you can make in the autonomy
That's right.
in a supervised way. So I had experience where I just happened to be late and I didn't really know the patients and I was a bit frazzled and whatever, and I just kind of, and the day just went worse because then the consultant was very involved. I didn't get to make any decisions. They did the anesthetic. I just and you felt very passive, and you kind of walk away going, that was very unsatisfactory. I felt like I didn't achieve anything, and I kind of then walked away a bit grumpy. And it was only reflecting afterwards. I was kind of like, well, if I turned up early and I did everything, then maybe they'd approach me differently. So the next day I came in half an hour early, had everything written up, had done the consents, the check-in, had drawn up. I didn't draw up drugs at the point because I was still quite junior, and I'd made all the decisions that I thought I was capable of making. And the consultant walked in and I told them my plan, and they're like, great, sat down and just let me do everything, which when I was like a first rotation quick care resident was like the biggest boost of confidence, because someone believed in me to do all that.
That's right. I say this phrase, and I hope people do take it lightly. I feel like your job, by being thorough and having a good work ethic, is to give your boss the confidence to give you enough rope. And I won't complete that sentence, but it's probably a bit morbid. But yeah, this whole being supervised is about me allowing, or the supervisor allowing the trainee, because they believe they have confidence in their ability to stretch them to the point of a bit of discomfort. And you can only get that by showing that you're competent to that level. So imagine someone does a lot of work, you go, wow, well, they've done a lot of work. They probably do deserve to do more things in that list. And it's okay if they get it wrong, because I will bail you out if and when you need it. But someone who's not performing at that level of thoroughness and work ethic, you probably think, oh, well, they're not ready for that yet. So there's a bit of a translation of how much you think someone's ready for based on how much work they're doing. And you got to go through that first stuff before you can get the other stuff.
Exactly.
Yes, I mean, like for example, I worked in a hospital that didn't do much regional anesthesia, but I did so much work to get my regional experience, calling the patient before and calling the surgeon to be okay with that, getting everything ready, getting the patient down before. Like, it was probably a good hour and a half of prep time to get one block or one potential block. And if you're not, I think in some circumstances, if you're not doing that kind of time, then you're not going to get the experience, and that's just how it is. I guess the next question is, so let's say you do all of these things and you're being very thorough and you've got a really great work ethic and you're showing interest, and you're asking relevant questions as well. How if you were to arrive late, or actually, here's a question. What do you do when you're about to arrive late?
I'm never late here. I can hear all my consultants laughing. So look, I think arriving late, there's a few ways you can approach it. And I think the best thing you can do is let the boss know.
Yeah, exactly. Before it happens,
and give them warning. And I think oftentimes, like, I have been known to be late. And I think when you are late and you turn up, and often the first thing the consultant goes, I don't really care if you're late. Like, it doesn't matter, but let me know, because otherwise I just think you're tardy. And often that's really all it takes. And sometimes you can't reach the boss, leave a message with a num. And sometimes the reason's like genuine, and it could be traffic, it could be whatever. Sometimes you just woke up late, and everyone's done this. I don't think a single person could say they've never been late. But I think, as you said, it's about giving people adequate notice so that the workflow and patient care is not compromised because of it.
Now, I had this almost a badge of pride where I feel like I was never less than 15 minutes early to every list. But that's not true, because I know that one time the daylight saving, I got daylight saving wrong, and I got a call. Oh, what happened? I got a call at 8:30, and like I wasn't at work yet. I was meant to start at 7:30, and anyway, 10 minutes I was in work, and I apologized, and everyone thought it was pretty funny. But I've like in 5 years of training, I think that happened twice. So things will happen, and I think I'm a really punctual person in general. But if it does happen, just call ahead. And it's so much better to call 15 minutes before than to rush in. And if you really were late and there's traffic for really genuine reasons, you don't want to be rushing in with the wrong frame of mind. A bit of a confession as well. So I remember one of my private lists that I did, probably my first year as a junior consultant, it was usually a half-day list, but then they just happened to put it as an all-day list because the surgeon had more work to do. And I just completely didn't realize that. Like, it was mentioned a couple of weeks before, and on that morning, I thought I had the morning off as normal. And so can you imagine my surprise getting a call at like 8:30 saying, where are you? And this person, I used to always arrive half an hour early to that list because there's a lot to do. And I remember thinking at that point, you know what, I'm just going to apologize.
Yeah.
There's nothing to be gained. It was a long day. Like, I was going to be working for 16 hours or so. So I didn't rush. I just went through, my normal thing, breakfast, shower, everything, and just drove safely to work and just went, I'm sorry, mistakes happen. So moving on from that then, you try not to be late, try to be early. You've got a lot of stuff to do as a junior, and getting in early helps you do that.
Sorry, I don't mean to check, but just on the whole idea of getting in early, I think this is something that is also quite important. Do you need to come in early, and how early do you need to come in?
That's a really good question.
And because whenever you ask this from a consultant, they go, no, just come in the same time I do.
Yeah.
But but it's also, I think, quite difficult because
Look, so technically you should come in for the hours you are paid. I feel like that's just a normal requirement for what the job is. The thing that I guess the reason why I'm uneasy saying that is, you want to get more experience. So I'd say you're not coming in early for anyone but you. Like, if you're a junior, the list is going to run fine, without you. You're really doing it to get more experience and get more action in the job.
Yeah.
And so I think you're coming in early for you. Obviously, you're probably not going to get paid for coming in early. So technically, you don't need to, but you will get more out of the day if you do. I just feel that do it for yourself. Don't do it for anyone else.
Yeah, I think the other thing is, often when consultants have trainees, they wouldn't come as early as they would if they were alone, because there's an expectation that some of the work would be done because that's your job as a trainee, because you are the primary anaesthetist, for most of those cases with the supervision of a consultant. So I think if you are coming late, so if you are not going to come early and have stuff ready, it does just then change the efficiency of the list, because then the consultant's on the back foot. And I think that also just creates an unsavory environment. So I think at the very least you should be there before your consultant.
Yep. Yeah. I mean, what I'd say is the consultant should always be there on time, and it shouldn't matter. But yeah, no, that's good. So I guess the next question is, when you in anesthesia, it's quite funny because I think coming from a ward job, you realize that, man, you get a lot of breaks in anesthesia, especially as a junior. So how long should you take a break for?
That's a bit of a philosophical question. I think generally in medicine, a break is 15 minutes and lunch is kind of 20 minutes to half an hour. And I think that's just generally kind of a good framework. It does differ depending on the boss, depending on the hospital and the culture and things like that.
I'd agree with that.
Would you? Yeah.
15 minutes for like a coffee break. And the reason I ask this question is, I think it's good to know, like, this is just our opinions right now. It's good to find out how long they expect you to be away from. Because if they say, take your time, take half an hour, or if they say take your time and then you take half an hour and they actually expect you to say take your time and only take 15 minutes max, that's a real change in expectations, right?
And people do often say that. They go, take your time, we'll be here for a while, don't rush. And I think they're very kind of unqualified statements that are really hard to base anything on.
Yeah.
But I do say, if someone said take your time, I probably wouldn't rush as much as if they're like, oh, did you go have a quick break? I think there is a qualification of the duration there.
Yeah. I used to always say something like, I'll be back at this time.
Yeah.
And then if there is a problem with that, then they know.
Yeah.
Because there is it's definitely something that we look at, I think, is that, why aren't they back? And maybe you are doing something really useful, seeing the next patient or reviewing a patient with some post-op problems. But again, I think there's definitely probably less autonomy in anesthesia at the start, where because they're supervising you and they want to see how you're doing at the job, they probably want a bit more reporting back and a bit more accountability to know exactly what you are doing. Because I guess they're responsible for you and want to see that you're getting the most out of your time. Yeah.
I think, again, like, if you're going to go and have study in your break, which I often did, I actually learned probably a bit late that I should just tell the boss I'm going to go study for the 15 minutes. Because then if you're a bit late, they kind of get it. Because sometimes you are studying, you're doing some revision or something, and you lose track of time.
Yes.
So I didn't do that a few times, and I just really think if you're clear and honest and you set your expectations on both ends, it's really good.
That's right.
Yeah.
Okay, so probably after all of this, you know your expectations for the rotation. You work with the same boss hopefully a few times that you get along with, and you do all these things to get yourself as qualified as possible for a good reference. How do you ask a consultant for a reference? Because you need to get a pretty exceptional reference a lot of the time.
Look, I think, it's difficult, but I think everyone knows the game by this point. I think everyone knows that you need good references to get into anesthesia. I think everyone knows you need good references to get into everything. I think some specialties are different. In some specialties, there's an expectation that if you're saying you're going to give a reference, you're going to give a 10 out of 10 reference. I think in anesthesia, it's probably not hasn't gone that far over to that side. I think references are still quite qualitative. So I think, when you ask a consultant, can I, would you mind being a referee? Some might go, oh, look, just so you know, I'm a very harsh marker.
Yep.
And that's just a very diplomatic way of saying, either A, they are a harsh marker, or they say, I'm not comfortable giving you what you're kind of looking for. And that might not be a reflection of your competence. That just might be, they just might have a different standard against which they measure trainees.
Yeah.
And I think some people might go, and I've had people say this to me, they've been like, oh, look, I actually haven't worked with you enough. Can you try arrange a few lists with me so I can assess you properly? So that's when I went and spoke to the admin staff and got myself rostered in a few lists. And then some people are like, great. And I think just be clear. I don't think if you're in a kind of a major hospital that has a big anesthetic department, you really need to say, oh, I need a good reference. I think that, to me, that sounds a bit strange.
Yeah, that's right.
If you could go, are you comfortable with giving me like a good reference for the program? I think that's still kind of okay, but it is very challenging.
Yeah, that's right.
What do you find?
And that is probably the language I'd use. Firstly, pre-selecting people, I think, is pretty important. But using the phrase something like, would you be comfortable giving me would you be comfortable giving me a reference? And maybe even saying, would you be comfortable giving me a competitive reference?
Yes.
Might be a way to phrase it. But what you said about, trying to work with people more often, and sometimes you just don't have that much time. So this is something you need to organize in your first couple of weeks. If you think, worked well with that person, maybe you've learnt from the previous years who is good to get a reference from, or who is good to work for, who's probably, more enthusiastic about teaching your staff. And, there's always a range of people in a department. So finding out who those people are might be useful. And then trying to time it so that in that, maybe you've only got 7 weeks, maybe you've only got 13 weeks, maybe you've got 6 months. But in that time, you need to think about a lot of things. And this is definitely one of them.
And I definitely said, don't leave it till the week before it's due.
Yeah.
Everyone's very busy. And I think a lot of people have very strict mindsets about not doing work stuff at home. And I think that's important to have a balance. So I think expecting someone to do a reference the day before it's due is it's not a good look. And I think it's an unfair expectation.
Yeah.
So what I would do is, in your first couple of weeks, don't stress about references. Just enjoy, find a few consultants you like, and then start thinking. And then you can approach them really early and say, hey, I think I did this with you. I was like, hey, I want a reference. And I think you said, yeah, great. Come do a few extra lists with me. And then you made an assessment, and then, you gave a reference. And I think another element of that is qualitative statements in the referee form is really important. Anyone can just write a whole bunch of 10s. I don't think that means much to someone assessing it. I think if you go write something specific, even if it's not particularly verbose, is far more useful. So yes. I often said that, I'm like, look, would you mind writing something like specific and detailed about me?
Yes. In the and I think that's a really good idea, actually. And something else you said was really good. Once you think that you enjoyed working with someone and you had that chemistry, that you were working well together, to tell them early on, hey, look, would you be able to observe me? I'll try to do a few more lists with you, maybe even do some extra lists with you. And in that time, would you look at me and give me advice so that I can potentially get a reference from you in the future? I think that's a really great strategic way. You don't surprise anyone. And for me personally, like I like to make one of the reasons I started doing the ABCs of Anaesthesia course was not just to teach people, but this is what I expect. Like my expectations are completely transparent. If you know the course, I will be super impressed, and you'll get the most exceptional reference. So asking that of your consultants who you might want a reference from, what do you expect, and please give me feedback. And asking for that feedback is a really useful thing.
I guess another question is, so one of the points you brought up earlier is, in an anesthesia, you only work with the boss once. But I think a point to also consider is that's once, assume it's 1 half-day list. That's 4 hours. You're in the same room talking to a consultant the whole time, potentially, if they want to talk to you. But I don't think any other specialty can really say that.
No, that's
that
right.
a consultant has said that spoken to a resident for that length of time.
Yes.
Registrars, yeah, sure, but not a resident. So I think don't underestimate the how much information people can ascertain about you in that time. I mean, obviously, I haven't supervised directly because I'm still a registrar, but when I've had residents or medical students, you immediately know what they're like just from the half day.
Yeah, and little things like if you're just having a normal chat, that probably you only get so much from, but little things, you'll never get the history right first time, but if the thing you said at the start of the list, they're reproducing at the end of the list, that's trainability. They've increased their learning curve. They've modified based on your feedback. But if they're not, that's a risk factor. Yeah.
And it also then gives people the opportunity to give you feedback and then for you to work on that.
Yeah, exactly.
Well.
Yeah.
Which I think is really important.
That's good.
Good. So I think we've talked about how to get reference, how to approach people, and what sort of things you could say to someone to get a reference. How about chasing up referees to submit things on time?
Yeah, I think that's really difficult. I think first of all, acknowledging that sometimes you need. I've recently had to write quite a few references for this one person, and I realized, wow, that's actually a decent job for them to organize, but also for me to organize myself to do it on time. And I think the way they approached it was quite good, which is, look, I'm sorry, I've got quite a few references. Would you mind sending it to these different places? And making it as easy for your boss. So this particular person did all the, filled in all the forms, with my name, email, the relevant, and made it easy for me. So all I had to do was go, yep, I'm sending this to that person, without having to do much myself except insert a document and put, insert an email. So make it as easy as possible. Potentially this person apologized for having so many references for me to fill out. But again, all I had to do is really just fill out one and copy paste because it's the same form. And then, also again, stating the obvious that, do you mind, this obviously means a lot to me, but would you mind if I just follow it up and just check that you've done it just in case? I know you're busy, that kind of thing. Just let them know that you'd like to check that it's been done, because I've heard horror stories of consultants saying, yep, I'll do it. And then at the very last minute, sorry, don't have time. That's not happened often, but
and probably not as much as in anesthesia, but
yeah, exactly.
So I would say that all, in my perspective, is actually the bare minimum. I think if you're asking a consultant to provide multiple references, if you haven't bothered to pre-fill it, I don't know. If I was being asked of me, I would probably still do it, but I would be like, I expect you to at least do this, because it's a lot of work for a consultant.
Oh no, you should definitely. Hold on, this isn't pre-filled. Are you missing something? It's almost like now I don't feel like giving you a reference because you didn't pre-fill it.
Do you need a pen? I can give you a pen. So some other tactics that I find are quite useful. So one of the orthopedic bosses I've asked for referee form said, great. He filled out a blank form, gave it to his assistant or the department assistant, and then got me to contact them. So I gave them a list of all the places, the fax numbers, the due dates. And then the assistant just filled in the details and faxed them out in time. And it was great. Once when I was for a more junior job, I got a consultant actually give me obviously trusted me, give me his referee form, which then I kind of filled out and then faxed to the different places. But I don't think that
doesn't work too much because they do want it sent by the consultant.
Correct. And I think the ANSCA one is also online, if I'm not mistaken. Maybe I'm wrong.
Yeah, maybe.
Yeah, I think it was online. So there are complexities, but I think again, be honest, be clear, and I think just when you chase up, just be polite.
Yeah, I think most people can do that. Really. Yeah. Oh, that's a good chat. Excellent. So I think you already mentioned what we went through. So thanks very much for watching and listening. There's ABCs of Anaesthesia, and please share with anyone who might be interested in this topic, anaesthesia or otherwise. and we'll see you again for the next time.
See ya. Thanks.